pterygium is abnormal growth on the surface of the eye, which is not a cancer, but which is a piece of tissue that over the course of time has the potential to become thickened and inflamed, causing a cosmetic blemish and in some situations, constant irritation on the surface of the eye. The reason why this part of the eye overgrows is that it can be stimulated by environmental factors, most importantly, sunlight, or the UV component of sunlight. We now know that this is the most important factor that's involved in the development of pterygium tissue. From the early years of life, under the age of 10 years, the amount of time we spend outdoors in bright sunlight and intense UV radiation does set the scene for the development of a pterygium. Additionally, the amount of time that's spent in outdoor situations for the remainder of life does influence ongoing potential for pterygium, as well as further growth of pterygium tissue once it's established. So the pink and thickened tissue of a pterygium most commonly is noticed on the inner corner of the eye, but it can happen on the outer corner of the eye as well. And that tissue grows over the clear front window of the eye that we normally use to see clearly. Over time, ongoing growth of that tissue across the clear front window can distort or interfere with the quality of vision. For pterygium that are small and don't cause any concern or symptoms, it is absolutely safe to monitor these only through annual reviews with an eye healthcare professional like an optometrist or an ophthalmologist. But for pterygium that cause concern, such as surface irritation, redness or discomfort, it's usually appropriate to use a simple treatment such as lubricating drops, which can be bought from the pharmacy over the counter. In some situations, significant inflammation may be treated with a short course of anti-inflammatory eye drops. However, for pterygium, which cause a lot of concern for either the appearance or symptoms that it's causing, surgery can be an effective treatment option. Fortunately, advances that have been made over the last couple of decades in pterygium removal surgery mean that it's a very safe procedure and one that is associated with excellent outcomes in terms of no pterygium tissue remaining on the surface of the eye that could grow back in the future, and in terms of the eye, once it's healed, having acceptable cosmetic appearance and feeling back to a normal level of comfort. Importantly, pterygium is a condition that can be managed, and certainly early identification of a pterygium can prevent further loss of vision or change in vision over time.